Hello and welcome to Rajya Sabha Television. You're watching our special show, India Fights Back, where we take a stock of the battle which we have mounted against the COVID-19 pandemic, all the challenges which we are tackling along the way. And now, as all of you are aware, we are in the vaccination phase. And in that particular phase, also we are entering the next stage. And that next stage will start from 1st of March, as has been decided by the Cabinet on Wednesday, that in the next stage, starting 1st of March, all those above 60 years of age and those above 45 years of age but with comorbidities will be vaccinated. Now, that's going to be a huge number and a very crucial number as well. All these vaccinations will take place at least at around 10,000 government health centers as well as private hospitals and private centers as well. Now, those who will be administered these vaccine shots at government centers will be obviously free of cost, but those which will be done at the private centers will be chargeable. The charges for this will be decided in the next few days and they will also be made public. So today we're going to talk about the importance of this particular phase and also what needs to be done in terms of tweaking the entire vaccination drive, in terms of focusing on what needs to be done in a much better way so that we do achieve our target there. And for more on this, we're joined by a distinguished panel of guests. Let me first introduce them to you, beginning with, we have Dr. Rakesh Aggarwal is with us, Director of the Jawaharlal Institute of Postgraduate Medical Research and Education in Puducherry. We also have with us Dr. Dhruv Chaudhary, the State Nodal Officer for COVID-19 in Haryana and Senior Professor and Head of the Pulmonary Department in PGIMS Rohtak. And we're also joined by Dr. Sunila Garg, Director, Professor and Head of the Community Medicine, Maulana Azad Medical College. Welcome all of you to Rajya Sabha Television. Let me begin with you, Dr. Aggarwal. Let's first start by giving our viewers a bit of a lowdown on this next phase, which I was referring to earlier and which has been approved by the Cabinet earlier. How crucial will this be and how many people will get the benefit?
So, Mr. Dahiya, till now we have had two phases. In the first phase, we covered the healthcare workers. In the second phase, we added vaccination of other frontline workers besides healthcare workers, which included people who were involved in enforcement of COVID precautions and those who run the economy, etc. And the third phase now is going to cover the elderly people. The idea of healthcare workers was they were the people who were at a high risk of acquiring infection, and if they get infected, of transmitting it to people because they deal with a lot of people. The same kind of a thing was true for the frontline workers. And now we are targeting the elderly, not because they have a higher risk of infection, but if they get infected, they have a higher risk of having severe disease, needing specialized care, needing oxygen, needing ICU care, and have a higher risk of mortality. So the number is directly proportional to the proportion of population that is above the age of 60 years. I'm not really well up with that number, but I believe it's somewhere about 8% of our population is in that age group. Dr. Garg will be much better at it. So that's going to be the number. And in addition, we can assume that there would be about 2% or 3% of people who would be above the age of 45 and would have severe comorbidities that increase the risk of severe disease markedly, and those would be covered. We don't yet have the list of comorbidities out, so we can't guess the actual number.
Okay. That's one point which I would like to bring you again here, Dr. Aggarwal, before I go to Dr. Dhruv, and that's when we're talking about comorbidities, which comorbidities are we looking at? Which diseases are considered to be, comorbidities in the age group of above 45 years?
So these are diseases that increase the risk of severe COVID infection. So this would mean uncontrolled diabetes, this would mean uncontrolled hypertension, severe heart disease, severe kidney disease, severe liver disease, diseases, really severe diseases of all other organ systems that increase this. Then there would be patients who have immunodeficiency, whose immune system is weak. Though there is not very clear data that those people are at a high risk of severe disease if they get COVID infection, but still around the world, they are being considered as a priority group. So those are the main conditions.
Okay. Dr. Dhruv, your views there on these aspects, specifically the next phase when we are looking at, these age groups and those with comorbidities.
I think probably if you really ask me, it's a very ambitious thing which we have done it. And government also realized probably that when they're opening up beyond 60, practically if I can recall, and Dr. Garg can confirm it, we are in 2011 census, we have more than 100 million people above 60 years of age. That means you need to do between 10 to 12 crore of people. Now that's a huge number. And already we are struggling with our healthcare workers and the frontline workers because of the vaccination hesitancy. But nevertheless, government realized it, and there was a demand. In particular, if you look at it from Maharashtra, where we suddenly found that people are asking that on the one side, yes, we need to look at the frontline workers, but at the same time, there's a large number of vulnerable people in the population. They will be coming, only then we will become vulnerable, isn't it? Therefore, so probably the government has tried to take what I can understand from the decision which has been taken today. There was these things were being discussed and informally, but now what government has now better I can say they've chewed the bullet now, and they said, okay, fair enough, we have agreed. Now let the private sector also come on board. We are opening up practically people above 60, and if you really see by default, including they've opened up 45 plus with the comorbidities. So if I take that number, practically nearly 15 crore people of the expected 30 crore you have thrown open. So without active participation of the private sector, it's just not possible. So the government is saying, what I understand is, which are vulnerable, which are economically deprived, which are a priority sector, we take care. Those who can afford, now we are opening up the private sector, you go and get it done so that we get the maximum people vaccinated so that we can run our affairs normally. I think that's the philosophy which has gone beyond it. And I think fair enough. The only thing we have to ensure is the supply chain command that has to be maintained. I think that's going to be an important issue.
Okay. Dr. Garg, I'd like to bring you in here. Would you agree that this is the most crucial and most important phase in this battle against COVID pandemic, when we are bringing in, those above 60 years of age and those with comorbidities above 45 to be vaccinated?
Vishal, it's a very important question. In fact, it's a beginning of, when we mean to say that we are beginning with the 60 and above and we are beginning with comorbids. So when we finish this, we will go down to less than 50 also in long run. So ultimately, it is aiming at 27 crore individuals now. So it's an ambitious task, but a very, very important task, because you see people who are elderly, as was mentioned by Dr. Aggarwal also, they comprise of over 8% of our population, and they are also suffering from lot of comorbidities like diabetes, hypertension, cardiovascular diseases, stroke, or chronic respiratory diseases, cancers and all that. So, in them also we'll be covering, plus in addition, 45 plus, they are also, so the 45 plus means that will also take care of 50 plus who are suffering from comorbidities. So that's a very huge task, but a very, very important task. And that's a real vulnerable group with which we are starting. An important part is that we have set up a line. We have started that we will be starting from 1st of March and we will be going ahead, with the vaccination to now people from the general population.
Okay, indeed, that is really, really important. And that brings us to a very crucial aspect of this important step. I'd like to start with you, Dr. Aggarwal, and that is to ensure the efficacy of this entire process. Now we've learned from our experience, during the past 45 odd days, because the vaccination drive started on 16th of January with the CoWIN app. There were glitches in between. Those glitches were, taken care of. And then time and again, the government, the authorities have once again pointed out that the entire process needs to be given a boost here. So in terms of the methods which are used for this vaccination drive, do we need a bit of a tweak here? There are suggestions coming in, for example, allowing walk-ins with proper authenticated identification and all that. How can we move further ahead in terms of making those positive changes there, Dr. Aggarwal?
So it's not that we are not tweaking the system. We have already tweaked the system several times, and that has to be done separately for different parts of the country in different situations. Already the app is working better We have learned a lot of messages. But when we go to a different phase, when we are doing it for the elderly, obviously different approaches will be needed. And I can assure you that processes are going on. It's a work in progress. A lot of work has been done on what would be the different challenges in this phase and how those are going to be handled. A lot of background work has been done. Now that the cabinet has finally taken the decision, a lot of those things will come out in the next few days in public domain, and we would hear how this is being done. So that is all planned.
Okay.
Also, some of this hesitancy is primarily because people think that COVID is now the done thing. It's gone because the disease frequency has come down. We are already seeing that in parts of the country where disease frequency is high, people are coming forward for the vaccination. And elderly, knowing that they are at a higher risk, I think the challenges would be fewer. Opening it up for self-registration also has problems because we might then end up with too many people landing at one center at one time, and that could by itself pose a different kind of challenge. So all this is being looked at. It will need some kind of tweaking as we go along in different phases, and that could have to be different in different parts of the country.
Okay. Dr. Dhruv, your views there on what more can be done to make this entire process more seamless, more effective?
You see, I will like to use, we are customizing rather than tweaking as per the need and requirement. I think as we are moving, what we are trying to tell is that the system is responsive, it is dynamic, and as the challenges are coming, we are moving ahead and taking things head on rather than running away from it. I think that's what I would like to say, one. Secondly, my own perception is that, and one feeling with being in the clinical, hardcore clinician and in the field is that you again will see that the people, especially the upper middle class and the rich class, they will be the people who will be coming up much more than the other persons. Because what we have found out, we did a small study at our place and we looked at it, the vaccination hesitancy is that those who had a COVID in the family, near dear ones, they have been far more there. It is the feeling of adverse events, the way it has come up, and the amount of information which has flooded, right or wrong, everything in the social media. So it becomes, people try to make up their mind. So I think what we have to do when we are doing this sort of a policy, trust me, and it's a private sector, it's practically, whether we like or dislike it, in the Indian real term, you have just made it, you walk in, you get your shot and go away. Now, for us, very important will be, at this point of time, to look at adverse event profiling, because we are seeing it right now that roughly with the dominantly what we have seen with the Covishield itself, our data is showing that anywhere up to 15% of the people are having adverse event. So we need to have a team or a battery who is looking at it to take care of these adverse event profile. Because once it is going out of it, it will get magnified much more than actually will be needing and required, which can put things at the jeopardy. So I don't know, the government must have had a plan, whole of it. So we need to, as Dr. Aggarwal has said it, we need to put systems in place, because if you have a place, let's say X amount or Y amount of cost, people will just walk, ask, demand it and move ahead. But then we need to have a system to follow so that none of them develop a major adverse event, because one major adverse event will be good enough to put it back.
Okay, definitely. That is pretty much required there, a system to be put in place. Dr. Sunil Agag, your views there, ma'am, as far as the overall process is concerned, and suggestions, if any, in terms of making it more, seamless.
Number one is that we have to create maximum awareness, because you see, as the number of cases are declining, but in few states, we are seeing, the variant strains, we are seeing upsurge in cases. That's where, people need to be informed about. Because as of now, the general knowledge is that the cases are coming down. So what is the need of vaccine? And also there is a vaccine hesitancy because of several reasons. It's not because of only that, the vaccine has come in a short period of time. Earlier, we were wanting the vaccine. And then, and people are dependent on many other people in Indian settings who act as formal or informal advisors for the vaccine. So this is where the media has to play a very, very critical and proactive role in motivating the individual. Second important thing is, one is the role of media. Second important is our healthcare workers, particularly in rural areas, urban slum areas, because everybody is not, kind of app savvy or computer savvy, or, they have to bring the persons also to the booth physically, by making active visits to, because ultimately we have to have a record that how many people we have covered out of, people who are 60 years and above. At the end of it, we are looking at monitoring and evaluation also. And the third part is that, we need to also look at adverse events, which have already been mentioned, but we need to also see that when we have, a large number of people coming, first of all, let's be very hopeful that large number of people will come. They should go with a very positive experience from the vaccination point. So that is another important thing which we need to see. But again and again, we need to address vaccine hesitancy, which is still there, kind of. So we need to look at that part also, since we are now involving the private sector and public sector both. So hopefully we should be able to cover the targets fast. And as has been pointed out by Dr. Dhruv also, that adverse events following immunization, here, whether it is private sector or public sector, there has got to be no compromise with this. People have to be observed and they have to be told thoroughly that please report the event even if when you go back, because the general tendency is that we need to take paracetamol or anti-allergic tablets ourselves, but these events, they go unreported. So that's also another thing which we need to keep in mind looking at.
Okay.
So it has not got to be one strategy, but a multi-pronged strategy which has to be adopted for vaccinating large number of people, including a strong private-public partnership. And we need to have data from our private partners that these many numbers have been there. And at the end of every day, we need to have a stock of that, how many people have been immunized for the first dose and for the second dose, because monitoring is a big challenge. So that is what the app was doing ultimately. So and we need to look at monitoring part so that media can give us appropriate information, how many have been covered, first dose, second dose, and we can take a stock of the situation gradually.
Okay, indeed, monitoring is required. But Dr. Garg, before I move on to the last question to Dr. Aggarwal, one thing which I would like to ask you again here is, since you also spoke about public-private partnership, the involvement of private players, Dr. Dhruv also referred to it. How do you believe the involvement of private players now will benefit in this entire process?
You see, private players have also been involved in the immunization of children. It's not that they're being involved for the first time. So, and we have a very strong Indian Academy of Pediatrics. We have, very strong professional associations who are involved in, particularly Indian Academy of Pediatrics, they are involved in that. So private sector is involved in a big way already in the immunization program. But it is for the first time we are in, and they're also giving, private practitioners are giving flu vaccines and pneumococcal vaccines to adults also, which is not a part of our immunization program, but they're giving that. So, I feel that involvement of private sector will be very, very crucial, because now it is in front of us large numbers. We have to see that and how we can cover these large numbers before we so-called are, scared of second wave, and we are scared of variants as well. So that's where private sector will play a very, very important role. Of course, as I said, monitoring will be a big challenge, where we have to make it, but the monitoring tools have to be very simple, where we need to look at not only the coverage, we need to look at the adverse events following immunization, and we also need to document the barriers and challenges on a day-to-day basis so that we can take the action, because it's a very dynamic process.
Okay. Dr. Aggarwal, your views there on the involvement of private sector, sir, involvement of private players. How will this help us in the long run?
So, I think in our population, the subsets that go to the public facilities and private facilities are very different. And if we go to one area, then one group is kind of somewhat excluded, and that is what would happen. Secondly, I think in both areas, we need to look at the community leaders, people who are opinion makers, such as film actors, etc., who receive vaccine. And we should be, now that we have moved away from special occupation groups, we should use them as, motivators, and so that would be very useful, because some of these people possibly go to private facilities, and if those people take vaccine, and then they are projected as having taken vaccine, that could help fight vaccine hesitancy.
Okay. Okay, Dr. Dhruv, on the private players part there, sir, you earlier spoke about how this is really important and crucial at this particular stage. So how do you believe this might help us in this battle against COVID-19 pandemic?
You see, I will come to that answer, but the one thing we have to be very clear, the urban and rural behavior is entirely different. And if you talk to the people in terms of COVID, everybody says it's your city's disease, it's not our rural. So for me, as a policy, as a planner, the challenge will be doing vaccination in rural areas. That is number one. Now let's come down to the private players. As Dr. Aggarwal said, Dr. Garg also said that the group of people who go there are different. So what you will see is, that, as I said at the beginning, upper middle class and the middle class people and the upper strata, they will be going there because they are going to ask you not only this, they will ask you the more different type of variety of vaccines. Therefore, I'm not seeing any clash at all. The government, by this policy, very cleverly and very smartly, has actually targeted that group which has been pestering and which have been actually repeatedly asking every day at Rohtak. I am being asked by the upper strata when we will start having vaccination, when we will have it. I think it is that group of people which will be there. For me, as in the public sector, the challenge will be come up how to get my residents, how to get people from the rural areas, because this is the first time such a big adult vaccination program has come up. Pediatrics, everybody is there. Now, everybody who gets a DPT or pentavalent vaccine has a fever. So mothers know it, so they are not bothered. But the moment it happens in the adults, they're all scared to get it. I think that's sort of a thing where we need to bring up pediatricians. We need to have a community health people, community leaders. And I personally feel, even now, it may be a little tongue-in-cheek, that the political leadership has to come up and show, yes, they are having vaccinations beside film stars and all. Trust me, it will change it. The hesitancy which was there, and will make it a success.
Okay, definitely. Those are the really important, crucial points. Thank you so much, Dr. Dhruv, Dr. Rakesh Aggarwal, as well as Dr. Sunila Garg for sharing your views here with us, as our panelists were pointing out, and as the cabinet has also taken a decision that the next phase of the vaccination drive will begin on 1st of March, wherein those above 60 years of age and those with comorbidities above 45 years of age will be vaccinated. And this time around, the private players will also be involved at a larger scale. More details will be obviously coming out in the next few days. But as our panelists said, the idea and the focus here should be a more informed decision. People should be informed in a better way. They should take a decision based on the right information which is there in the public domain, and also come forward for the vaccination as part of this particular drive. But all apart, the vaccines apart, everything, one thing which is really important and crucial is to ensure adherence to the COVID appropriate behavior, and that is a simple three-step process. First, you have to ensure that you wear your mask at all times when you get out of your house. Also, please ensure that you adhere to hand hygiene, wash your hands regularly and properly at regular intervals, and please ensure that you also maintain physical distancing while in public spaces. These three simple steps will not only safeguard you, but also your near and dear ones. That's all we have in this episode of India Fights Back. We'll come back again with a different topic. Till then, keep watching Rajya Sabha Television. Thank you.